it was something I came out at the end of treatment thinking, okay, so I don't have cancer, but I am now, I felt like a completely different person. I felt like everything had changed physically, mentally, emotionally.
Yeah.
And I didn't even know who I was anymore, didn't recognize myself. And it was almost like having to be completely reborn and start again. I think what we don't realize is that you get rid of the cancer, theoretically, you know, that's dealt with, but you're now left with the long-term conditions as a result of the treatment. And that's par for the course. But in terms of perhaps having a meeting at the end of treatment and being put onto various other services, you know, with physio and things, I went and found that myself. I had a really, really fantastic GP who saw me literally once a month all the way through my treatment and for probably a year post my treatment. But I really did have to go and find that myself. And it's almost that sense of, okay, our part of the job's done, now off you go. And being left, it's like being left out in the wilderness and saying, okay, what do I do now? You know, I've been left with fatigue, I've been left with pain, I have to take pain medication to manage that pain, and you know, that's probably going to be forever. And all those people that came in support afterwards were absolutely fantastic, but I certainly wasn't signposted directly by my CNS teams. Perhaps having a proper meeting at the end of treatment after, you know, you've had a chance just to take a breath. I don't mean immediately, but perhaps a month or so after, and saying, okay, how are you feeling? What are the things that we need to support you with?
I think my body is quite adjusted, surprisingly, to it. And maybe because right after chemotherapy I started, my body was still in shock in terms of like what's going on with chemotherapy. And
Yeah,
I added the tamoxifen, so it kind of like
yeah,
mixed, got into the mixture of complications. I I feel like when we are going through hard times like this in our lives, a cancer or a death or difficult times, this inner strength comes in. It's amazing. Like it's just like it's built into our system, like that resilience. And then as soon as the difficulty goes away, hopefully, then I started to feel like I'm losing touch with that and started to feel like I'm back to things that I no longer want to complain, or like my mindset is shifting back to where it was before the treatment. So just seeing that shift is quite interesting. It's such a creative period in it can be one's life. I feel
yeah,
like if we can express the things that we couldn't express in the past, like if you feel like all these things bottled up, and this is how sicknesses are born, right? And I felt like I was able to just like let things out.
yeah.
However, we are humans. Now I'm still complaining about when the weather is not good and all of that
Yes.
stupid, silly stuff that we no longer need to do.
Treatment. I carried on doing exercises, got back to playing golf and tennis and walking. There's a walk called the Tongariro Crossing that we wanted to do, which is 16k, and it's a pretty big climb. And I wanted to get myself fit to do that. So, you know, I got incentives to get myself fit, basically.
I was being given morphine and codeine, obviously, to manage the pain. And I was having a horrible, horrible reaction to that. And I was absolutely, it was like being in some kind of living nightmare. I was hallucinating. I was too scared to shut my eyes, because the minute I shut my eyes, there was horrible creatures. The nurses who were coming in and giving me tablets and checking on me were all morphing into funny shapes. It was absolutely terrifying. And on top of that, I was finding it quite hard to breathe, and you know, my sort of saturation levels were very low. It wasn't until 4 days in that one of the registrars who was doing the early morning shift and just coming in to check on me, said, "Are you okay?" And it was the first time anyone actually directly asked me, "Are you okay?" And I said, "No, I'm not. I don't understand what's going on." And I explained what was happening. She said, "It's okay, you're having a reaction to the opiates." Now, I don't remember the nurses at any point saying to me, "Are you okay?" If that question had been asked, it would have given me the opportunity to say, and although it sounds counterintuitive that I wasn't able to say to someone, "There's a monster," I couldn't, because I was almost in this kind of living nightmare. So I asked one of the nurses to help me, and her response was, "Well, just get out of bed, you're not made of glass." Now it's so thoughtless, and it's actually quite unkind. That is the message I'd like to get across, that it was the people that were kind and the people that were unkind that stick in my mind. And I would just really like to say, be very aware of how you're speaking to people and how that's being heard. So it comes back to communication again for me.
How I see how much they work so hard. Like I see it every day when I was in chemotherapy. People would come and all kinds of demands, all kinds of suffering they see. I always loved talking to the nurses in terms of whether they had child or like they were mother. And many of them were very compassionate. And this could be also about the culture itself. Turkish culture tend to be very compassionate and warm. So it was lovely to be able to receive treatment from these like angels, I want to say. So I'm just so thankful for all of them from the bottom of my heart. After the chemotherapy, I was very, even though I was well taken care, I was mentally and physically feeling very poor. Yeah. And we were waiting in the waiting room for the first meeting with my radiation doctor, radiologist. And during that time, the waiting period kind of kept delayed, and like originally it was 15 minutes and half an hour. Of course, the doctor is seeing others, so it's hard for them to give an exact time. And I think my blood pressure dropped or something happened. I can't remember quite, but I start not feeling well, and I was almost gonna pass out, and I started crying, like, why are we waiting and all of that. And probably they see it every day. And one of them came, and I think she was one of the nurses came next to me, and she was trying to like give me like warm feelings, or like trying to reconcile me. And she used the language saying, she asked like, "Oh, what's up? What's going on?" And I said, "I'm feeling very low. It feels very like busy, and I haven't eaten anything well this morning." And she asked what stage I am, and I said I am stage 2. And then I could even like I heard it in her tone of voice as well. She was like, "Oh, stage 2. I thought it's like stage 4 or something. You should be grateful. You should be grateful that you're not stage 4. I mean, come on," or something like that. It was very invalidating and like comparing. This is something I talk a lot in my podcasts as well. Like they become so compassion fatigue, I think sometimes, and they are trying to like validate, but it's coming from a place of comparing people's suffering. Like all patient need is just to be heard and listen, like making sure like, oh, I am being listened. This person is paying attention to me, rather than trying to skip the subject or move on because they feel uncomfortable. When we don't have inner space, like when we are so stressed out, and when we are not having a good day, or all these things happen in the household, it's hard for us to be present with somebody else's pain. So I think that's why also it's very important for nurses to take care of their own inner pain or stress, so they have inner space for others to receive and give. In order for us to take care of others, in order for us to give compassion to others, I keep using the language compassion because this is what my training was in the psychotherapy program at school. And I think nurses are the best, most compassionate people. And it's so hard for them because it's expected for them to be compassionate. But I feel like in order for them to be compassionate to others, they first need to be compassionate to themselves.
There could be more information given about the side effects of the various treatments, which we've already really talked about, to make sure that, the name on the form is who it is. I can't think of anything because, as I say, I thought my treatment was fantastic. So, I wouldn't criticise.
I have taken control of a lot of things. I've completely reworked my diet. I do meditation. I do yoga. I walk. I'm very aware of my own fatigue. I do a lot of self-care now. I'm very and above all, I'm telling everyone else to be kind. I'm kind to myself now, and I have learned that the way that I can manage and live well is to invest in my own health and well-being, and that's in mentally, emotionally, physically. Having said all of that, I feel fantastic, and I'm very proud of myself, and I consider myself to be a bit of a champion. And it's been an amazing journey, and I'm able to say that because I'm so much further on. I lost a lot of friends through cancer and things because, again, people don't want to deal with it, but I'm very proud of myself, and I now, as I say, I'm now working as a cancer support worker, and that brings me immense satisfaction because I just feel like if I'd had someone in my corner like me, that would have made all the difference. And just having someone that I could just have a chat to, I don't think I'd change anything. And that sounds a really odd thing to say, but I'm almost, I think, a more fulfilled person now because I understand what's important in life. It made me wake up and realize that there was so much stuff literally that is flying around that actually means nothing.
A part of me is super grateful that I went through this experience and pass it through with health. Like, I'm feeling very healthy right now.
In fact, 3 years ago, I also had prostate cancer as well. And really, the only reason I was diagnosed with that was because I was on the impact study, and the Professor Barwell up in Leicester, who looks after me on that side, he insisted to go because my PSA had gone up slightly. I mean, it was only 3.8, so normally I wouldn't be referred. I've just finished my last consultation virtually with the oncologist, and he's signed me off onto a watch and brief now. By becoming a volunteer at breast cancer now, that's widened up a lot of experiences for me. What my wife says, it's made me a better person, in as much as that I don't get quite so angry with things as I perhaps did before, with politicians and things like that. And it gives you a different perspective on things, really.
I'd like you to see the patient holistically as a human being, okay, and understand that they are just and I'm going to go ordinary person who is going through a challenging and terrifying experience. And I would encourage nurses to, number one, speak and engage with the patient. Number two, ask how they are and listen to the answer. Number three, acknowledge the person and how they feel. Number 4, be caring, empathetic and understanding. And the big one, number 5, above all, show kindness. I think it's very, I don't want the things that I've said to be heard as negative, because I think there is always the opportunity to learn. I've had to learn, and it gives, you know, nurses the opportunity to learn. There is no doubt, I have great admiration for everything that the nurses do, and it's an incredibly difficult job. And I think as a patient, we all know that. And that's almost the point at where that's where it gets a bit confusing, because there's that dynamic going on, and actually, if there was just that little bit that bridged the gap and you're seeing each other as people, I think you would get much better patient outcomes.
No, I you know, I think they did a fantastic job, and I really, you know, I couldn't, I can't say anything more about it. You know, they were just brilliant.
In order for us to take care of others, in order for us to give compassion to others, I keep using the language compassion, because this is what my training was in the psychotherapy program at school. And I think nurses are the best, most compassionate people. And it's so hard for them because it's expected for them to be compassionate. But I feel like in order for them to be compassionate to others, they first need to be compassionate to themselves. Whether this is taking 5 minutes breaks, walking, meditation, calling a loved one, I think, or reminding themselves they are doing such a meaningful job. And so many people are grateful. They are saving lives every day. I'm just purely grateful. That's really all the things I can say. It's not an easy job, and thank you. I'm glad they are present.